Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. Before we get started today with our guest, I want to make sure and give a thanks to Hubbard Radio for allowing us to use their space and share their recording studio with us so that you all are able to join us for all these wonderful conversations. So on today's podcast, I have two guests with me. Welcome, Brenda and Brad.
Thank you.
Thank you.
And I will let you two introduce yourselves. Because I will probably get things all wrong on titles and organizations and the things you're doing. So why don't we start with a quick introduction and then we can go from there.
All right. Sounds good. Hi, my name is Brenda Schell. I'm the Public Health Analyst and Liaison for the state of Missouri for the Overdose Response Strategy. I've been doing this job almost 5 years. Mm-hmm. Prior to that, I worked for the DEA as a diversion outreach coordinator.
Yeah.
Brad?
Excellent.
Yeah, my name is Brad Germann. I'm a trooper with the Missouri State Highway Patrol, and I am assigned to the Division of Drug and Crime Control as their public information officer, and I've been a trooper since 2002.
Well, welcome. Thank you both for joining me today. So, it sounds like, from both of your introductions and titles, obviously Prevent+Ed and the PrevenTable, we're talking about really kind of this intersection with substance use and, everyday life that people are living. And we know that the opioid crisis particularly has continued in our communities. We've seen some recent data that shows some hope around reduction in overdose rates, particularly in the St. Louis region. Unfortunately, some increase in the Kansas City side of the state. But, it seems like some of the strategies that we've put in place over the last decade are maybe starting to have an impact. And of course, we'd like that to continue. But what are you all seeing? Just kind of big picture in the work that you do and looking at the data and analyzing numbers. Is that kind of the same story that you're seeing and the same work?
Go ahead, Brad.
Yeah, statewide, we've seen a reduction in overdoses. Obviously, it's higher still than we would like it to be. But nationwide, it's a nationwide trend. And obviously, us living in the Midwest, St. Louis side of the state and Kansas City side of the state, we get influences from both East and West Coast. We've seen a significant downward turn since 2022, 2023. And but like in Missouri, in 2022 we had 2,100 deaths roughly due to overdoses, and last year, if the stats are still correct, it should be right around 1,500, just under 1,500. Yeah. But we're still way too many people, unfortunately.
Oh, absolutely, way too many people, and I think it's hard, at least from where I sit, and you all can agree or disagree. But in the work that we do, when we hear about reduction in numbers. And, sometimes there's a tendency or reaction to be really excited about that, of course. But then you're right. Those 1,500 people are still humans and are still people who have people that cared about them and that cared about other people in this world. And it's still way too many. And so, while we want to acknowledge reduction, we know we're not to the finish line yet. We're nowhere near it.
That's right,
still.
Jenny.
Yeah.
And as Brad said, 2024 marked a year of significant progress in Missouri, with drug overdose deaths falling by more than a quarter. So they went from 1,948 in 2023 to 1,450 in 2024, which was almost a 500 deduction, which is saving 500 lives. It's a 26% decline in overdose fatalities, and the drug overdose deaths rose steadily from 2019 to 2022, as Brad said. And then they started decreasing, and I think that was mainly due to state naloxone distribution and saturation across the state of Missouri.
So we've talked a lot about naloxone in other episodes of the podcast, but just a reminder to people listening, if they might be their first time tuning in, that naloxone is the opioid overdose reversal medication. So naloxone, sometimes known as Narcan, can be administered for someone experiencing an overdose, and it will essentially allow the person to start breathing again and reverse some of the fatal impact of the overdose.
That's right. And I don't know if your listeners know the signs and symptoms of an opioid overdose. You know, we might want to go over those as
Sure.
far as unconsciousness, can't be woken up, pinpoint pupils, slow and shallow breathing, kind of choking and gurgling sounds, and the lips and nails may turn blue or gray. And that is the time to administer naloxone or Narcan, and to also call 911.
Absolutely. Yes, yes.
And I also wanted to give you some numbers. We talk about naloxone. So in my job with the overdose response strategy, I work closely with the Department of Health and Senior Services and the Department of Mental Health and the Missouri Institute of Mental Health. And we are working together to help saturate the state of Missouri with naloxone. And between July 1st of 2024 and June 30th of 2025, Missouri distributed 639,157 naloxone kits
Wow.
to 1,500 unique partners in all of the 115 counties in the state of Missouri. So that's very, very good to know. In fiscal year 2023, there was 155,000 kits administered. In fiscal year 2024, there was over 330,000 kits administered. And then in fiscal year 2025, there was 639,157 kits administered. So that's really showing progression, and I think that's why the deaths are going down.
Yeah. So absolutely, yeah, that, we have more of this medication, life-saving medication available in communities. We would hope that it's having that impact, that we're seeing a reduction in the deaths as well. Yeah. So Brad, in your time in law enforcement and your career, is there any other factors or, anything that you've seen in trends with naloxone or other factors that you might think are contributing to the reduction in overdose deaths?
Yeah, there was a large push. I've seen a lot of changes on the road, on highway safety, and obviously I work the I-70 corridor, so we got a lot of drugs coming through Columbia, Jefferson City, St. Louis, Kansas City, but I can tell you that, on any given night of any given day, we would get a call of an unresponsive person. And I'd like to also remind your listeners that, it is the number one cause of death for Missourians between the age of 18 and 44 still.
Yeah.
So we're making improvements, but there still needs to be a lot more done. But I would encourage with painkillers, it's an epidemic. I mean, the United States, has 4% of the world's population, but yet, there's, and again, these figures vary, but 70 to 80% of the world's opioids we use here in the U.S. So it's been a problem for a long time. We're not going to fix it overnight. But I think not only with Narcan and naloxone, just public information, getting the word out, how dangerous a lot of these medications are, as well as the illicit side of things.
And I think we need to make sure that people understand that naloxone is very safe to use. If you think someone has overdosed and you provide that naloxone, even if they haven't overdosed, it's not going to hurt them.
Yeah, right. It is effective and safe to use, and more widely available, I think is all the reasons, that we can make sure that we continue to have this accessible for people in communities. There's really no side effects, right? I often tell people in training that I can confidently say right now, if I were doing a training, like, I don't have opioids in my system. If you administered me naloxone, I'd have a wet nose. That would be my side effect. That's
right.
So,
and people need to know, who are listening, that you can get free naloxone in the state of Missouri at www.getmissourinaloxone.com.
Excellent. Thank you, Brenda.
Yes.
So we know that, we were talking a lot about naloxone, and it's, like I said, a very important strategy and tool, but overdose deaths, I mean, that's one way we measure the impact, right, of substances and substance use in our communities. And having naloxone be able to help contribute to that reduction in deaths is important. But even when somebody is administered naloxone, and so they are not recorded in a fatal overdose death, there's still impact to this individual, to their families, to the community related to a substance use disorder. So what are some of those other impacts, or what are some of those other ways that, in your respective positions and roles and communities, that you're seeing some of those other impacts?
Yeah, I mean, it's full circle. We have individuals that have substance abuse issues, have other underlying issues as well, and it's unfortunate, but it affects all demographics. I mean, from the poor communities all the way up to the more affluent areas of the state. We're seeing deaths everywhere. And not only that, but just the issues that come along with narcotics abuse in general, whether it's abusive situations for females or, sex trafficking. I mean, it unfortunately, the drug world, it influences burglaries, just crime in general. People need that fix when they're addicted to drugs, and unfortunately, our first responders and our crime fighters out there are seeing it firsthand what the ramification of drug abuse is.
And I think we also need to think about the kids that are put in foster care and the grandparents who are raising their children because of these individuals who have died. And as you stated, these are moms and dads and brothers and sisters and aunts and uncles. So we have to make sure that we humanize this epidemic.
Oh, absolutely. And even in, when we think about people, again, there's a lot of space in between someone using a substance and overdoses, right? And all of that impact, whether it's the kids in the home or kids being removed from home and their lives, but then also we're looking at, other systems and other workforces that are impacted. And so, making sure that we have some of those wraparound supports and that we're really looking at the big picture. Sometimes we have to take a step back. I think, or I'll speak for myself, we get kind of in our groove of what our job is or what our role is. And then, when you start to kind of really zoom out, you see more and more of how lives are really affected.
Yeah, and I did want to share with you, Jenny, some of what the overdose response strategy is doing in Missouri.
Yes,
there are 61 teams across the United States. So there is a public health analyst, myself, and then Van Godsey is actually my drug intelligence officer. Brad is filling in today.
Thank you, Brad.
No problem.
But in the larger states of Florida, Texas, and California, they have 3 or 4 teams. So there's 61 teams across the state or across the United States. Some things that we were doing here in Missouri is we're working with the Overdose Data to Action. It's called OD2A team. They are funded by the CDC, and we're working on surveillance strategies with them to better capture, analyze, and disseminate overdose surveillance data. We're working with Department of Health and Senior Services and the Missouri Hospital Association. So if someone comes in to the emergency room, emergency department, and they've overdosed, they're using the plasma and testing that, and then we're sending that information out. We're also working...
So, sorry, can I jump in
yeah,
here?
Go ahead.
So when testing for kind of figuring out what all is in the substance that caused the overdose, so like really helping to track, is it fentanyl, is it xylazine, like what are we really talking about here?
Yes,
okay.
that is true. Also, we're working with St. Louis County Medical Examiner's Office on the Eagle Fang, which is toxicology testing of drug products and paraphernalia and the drugs that are on the streets. That's really helping us understand the landscape and what is in these drugs. Some individuals think they may be taking an Adderall, and when it's tested, it could be laced with fentanyl and cocaine.
So what are some of those results showing? Like as we've been analyzing some drugs, are there anything that's popping up that are surprises or that kind of were like unexpected things that
I think there's new things coming up all the time. Brad's going to talk about those, but I'll tell you, the wave one was the prescription drug overdose. And of course, Missouri was the last to get the prescription drug monitoring program.
Yes, we were.
And then wave two was the heroin overdose. Wave three was the fentanyl, synthetic opioids. And now wave four is fentanyl and the stimulants.
Gotcha.
And as viewers may not know, Narcan does not revive someone who has taken a stimulant, who has overdosed. But what we're seeing in the streets is that a lot of those drugs are laced with an opioid. So always administer naloxone.
Right. Even if you think that it's only been a stimulant or only been something
Correct.
else, you sometimes don't know what fentanyl could be included.
And maybe Brad wants to share some of the drugs.
Yeah, with cocaine, methamphetamine, this is some of the more common street drugs out there. We are seeing xylazine mixed in with those drugs.
And
they're laced with xylazine.
And xylazine's not an opioid either, right?
Well, it
looks like an opioid, but
right. It's actually a veterinarian medicine.
Yeah.
And actually, they use it for sedation with animals, and it's being produced just like fentanyl overseas, and it's being trafficked into the United States. But it's very, very potent, and you might have heard the street name Trank. But that's the street name for it. But it's being laced, and it makes the drug just that much more potent and deadly.
Yeah.
And also, if xylazine is mixed in, people are getting necrotic wounds because of that.
Yeah, so the xylazine can have even, more, like you said, like kind of really enhance and more potent in the substance, but then also have some other physical side effects that people, aren't aware of or aren't sure. And then, with those wounds, of course, you have risk of infection and all kinds of other complications. And if you're not seeking treatment for those things, can be deadly or very harmful to people too.
Yep. What other drugs do you want to?
Nitazines have made a comeback, and that was a drug that was never intended. Well, it was made for human use, but it was never approved by the federal government because it's so potent and so dangerous. We're seeing that mixed in as well. It's not quite as prevalent yet, but it is coming in. And again, at the end of the day, I think it's important that everybody knows that if you show signs, though, of an opioid overdose, again, Narcan or naloxone is the way to go. The sooner you administer it, the better. So it doesn't matter whether these drugs are laced with stimulants. The chance of having an opioid in the drug is pretty high.
Yeah. And you're not going to know that at the time. I mean, no one's going to know. The person using the substance might know. The bystander, isn't going to know. So better to be safe than sorry and be able to administer the naloxone. But
when Brenda, you mentioned earlier pinpointed eyes, pupils. I can tell you that you will recognize that right off the bat. If that individual's eyes are closed or whether they're staring off into space, if you can see their pupils and they have a pinpoint, and when I say pinpoint, I mean a pencil point, that's how, constricted those pupils are. There's a really good chance that they're suffering from an overdose on opioids.
Yeah. And Jenny, when we talked about the decrease in fatal and non-fatal overdoses, something that I want to bring to light is that I worked with the Department of Corrections and with other partners, and we started training, OEND, overdose education and naloxone distribution within the Missouri prisons. And each prison guard now carries naloxone, and each individual who is released from the Department of Corrections has naloxone along with probation and parole. So I think that has really helped with the statistics that we've shared today.
Yeah. I think so. And I was just having a thought, Brenda. I know you and I have known each other for many, many years. Yep. And Brad, you've been in the field, doing law enforcement for many years. And I think sometimes when we might have been doing this for so long, I know I have really started to think everyone knows about naloxone, right? Everyone knows about Narcan. And then regularly I'm reminded not everyone does, or not everyone knows where to get it or understands that it is safe. So I think, that constant communication and I love hearing more sectors and more people carrying it in, depending on their workplace or their their locations, and then that's just more individuals that are comfortable with it too and understanding.
Yeah, and because of the state opioid response funding and other funding, the EMS, our law enforcement, the local public health departments in each of the counties in Missouri have that available. So, there's no excuse not to have it. It's also over the counter. You can get it in any pharmacy over the counter.
Right. Or available. I know in the St. Louis region here, we have many different 24/7 access points through the vending machines or boxes or, different kind of devices, whatever that might look like, where you don't even have to interact with another person. If you're worried about what somebody might say or think about you having Narcan, you can go pick it up anonymously from a variety of places.
Yeah, and, we talk about Stop the Bleed and the AED. I wish that naloxone would be available. I know a lot of, let's say some of the organizations and businesses throughout the state of Missouri have gotten a naloxone kit box, and it's there and it's readily available. But wouldn't that be great if it was readily available at every place where people gather?
Right, and that people could be able to just have it there, take it with them if they think they need it at home. Yeah,
I think it's really important too that our listeners understand the fact that drug dealers, couriers, they're becoming very creative when it comes to producing counterfeit medications. And what looks like an OxyContin pill or a Percocet pill, if it's not in a prescription bottle and it didn't come from your doctor, there's a good chance it's laced with fentanyl.
Right, but it's counterfeit.
And they're literally making counterfeit medications that mimic these drugs, and unfortunately, people are dying from that and thinking they're taking a legitimate medication, whether it's they need it for a short time high or they can't find heroin because heroin's becoming a lot less prevalent. And again, I contribute that a lot to the fentanyl crisis as well.
Absolutely.
And I use the analogy, and people really understand it. It's like baking chocolate chip cookies. You put all of your ingredients into the bowl, and you put your chocolate chips in at the end, and you stir it, and then you dip it out on your baking pan. When you get those cookies, you may have 10 chocolate chips or you may have 2 chocolate chips in your cookie. And so, that's the same with fentanyl. These drug dealers are not measuring how much fentanyl they are putting in their batch, and so you could get a deadly amount.
Absolutely. Or, even if it's a different amount than you had the last time.
Yes.
So if I'm eating your cookies, Brenda, and I'm like, ooh, Brenda makes the best cookies because they're so chocolatey, my next one might not be as good.
That's
or
right.
It might be even more chocolatey.
Or it might be your last.
Yeah, or it might be my last. That's right.
Yep.
Because I might not want it again. Well, is there anything, as we're looking forward, anything that, either of you have on a wish list or excitement for the future as you're thinking about, how we continue to address this crisis in our communities?
Well, I think we need to get out of our silos, and we're doing a very good job doing that. We've got law enforcement, we've got public health working together. We definitely need more funding for prevention, treatment, and recovery, as you know. And I've worked with several counties who are creating overdose fatality reviews, okay? And overdose fatality reviews, they are locally based, multidisciplinary process of understanding the risk factors and circumstances leading to a fatal overdose. We've got those in Greene County, Springfield, and in Kansas City now. And the goals of the overdose fatality review is really just to recognize and address the gaps and the barriers in services and to save lives. So I would love to see more counties look at creating an overdose fatality review.
Excellent. How about you, Brad?
I would like to just mention that, as parents, I've got younger children. I got one that just is in high school and the other one just going off to college. But, this problem, again, it's impacting every demographic out there. And if you're naive if you think it's not being consumed in every high school, and open dialogue between you and your children is key. The more they are informed about the dangers, the less likely they are to take a drug or experiment with a drug. And I think that's very, very important. I mean, unfortunately, our teens are being influenced by peers sometimes, and their peers aren't necessarily the best influence in the world.
And I think we need to normalize the conversation.
Absolutely.
There has to be conversations at the dinner table. There has to be conversations with neighbors, with family members, with the kids. We need to keep talking about it.
Yep, we can't be afraid to talk about it. Absolutely. Well, thank you both for joining me today on The PrevenTable. Thank you to all of our listeners for tuning in. If you've liked what you heard, please subscribe or join us on anywhere where you access your podcast. We'll see you next time.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PrevenTEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.